Hello, my name is Ashley Alonso. I will be talking about the improvement for success for new perioperative nurses, specifically looking at the orientation for perioperative nurses. An overview of the community, you'd be looking at the perioperative nurse can usually be found in an acute care setting such as a hospital, outpatient procedural clinic, or even a short stay facility. For this particular project, the culture of a perioperative nurse in the GI lab within a hospital setting will be assessed. Our particular GI lab at the hospital, we admit patients, participate in procedures in various ways, and also recover the patients. Our lab facilitates 3 GI doctors and 5 surgeons on any given day. There are 8 admitting bays and 4 procedure rooms, as well as 7 recovery bays. The full staff consists of 13 full-time RNs, 12 PRN RNs, and 5 GI lab techs, full and part-time. In our lab, most common procedures performed in the lab include colonoscopies, EGDs, endoscopic ultrasounds, which we call EUSs, and then also endoscopic retrograde cholangio pancreatography, or ERCP. Specifically, those are done in the OR, but GI lab staff do those. Looking at the community culture for the GI lab, specifically in our GI lab, the leadership style that I would say is the high structure, high task, and high consideration, high relationships. So, finding that balance between deciding on what needs to be done and completed, as well as listening to what the group wants and their desires, concerns, that kind of thing. So you also find the 4-day work week or less, depending on if you're full-time or part-time. The experience of nurses range from 10 plus years in GI specifically to a nurse that has previous work experience in a different area to a brand new out of school nurse. So there's a lot of range there in experience in the nurses in our GI lab. Not specific to the GI lab, there is a hospital offered program called the PACE program. That's for full-time nurses to kind of research and then implement evidence-based practice into daily practice for all nurses. GI lab nurses can participate in that, but it is not GI lab specific. And then another part of the community and the culture that we have is that nurses work in a different area in the GI lab on any given day. So one day you could be in admitting, one day you can be in recovery, one day you can be in the procedure room as the nurse, and another day you can be in the procedure room as the tech. And so you kind of have to know all the different areas of the GI lab to be proficient. And then lastly, another look at the community culture would be looking at the orientation for new nurses. Right now it's 6 weeks at 40 hours a week with a set schedule of 7 to 3:30. And then we also take call in the GI lab. And so new nurses to the GI lab would be on a 4 to 6 month call or on-call orientation, or we'll call a buddy call. The orientation portion of the community kind of leads me into what is specifically the issue at hand. Our orientation for a new nurse coming into the GI lab, in our GI lab, does not contain a skills lab competency. So currently, new nursing hires to the GI lab are not required to provide a competency checkoff for particular skills needed within the job at this GI lab by the end of their orientation. And it is not a requirement of orientation for a new nurse that they show proficiency in the different procedures performed in the GI lab. So this is important because we can be techs in the room and we can be the nurse in the room. And even in admitting and recovering, it's always a good idea to have knowledge about what goes on and how certain procedures are done. Some of the procedures we do are very specialized and very specific, and you don't see very often. And so it's kind of a good thing that all the nurses would need to know. So we don't have an actual skills competency or a skills lab to kind of go over all the different procedures and the equipment and everything that goes into it. So that's the particular issue that we have right now with our orientation. This kind of leads into nursing orientees not being prepared for the skill sets of the job of perioperative nursing after orientation has been completed. According to Whelan, Shi, York, et al., the traditional surgical training model is when a person has to do various skills under the supervision of a team member within a complex operating room environment. They suggest that there is a connection between low retention rates of OR nurses with the use of this model and the actual competency and the confidence of the nurse in training. So, you know, that kind of just is saying that the traditional way of doing things, you know, in the actual operating with an actual patient in a complex environment is not the best way to learn something for the first time. So that kind of makes things a little overwhelming, which then could lead to not actually being competent in what's going on and how to do it, and not being confident, which then leads into, you know, nurses saying, I don't want to be a part of this. It's too much. Therefore, they go do something different. So the question we need to ask is, does a skills lab during orientation increase the success of a new perioperative nurse? Whelan, Shi, York, et al. Also state that research has shown that scripted simulations designed for specific areas of expertise can help a novice nurse grow into an expert role through practice and the opportunity to receive cues from the rest of the team, rest of the OR team in an environment where there is no risk to the patient. Also, according to Brown, Sean, Armit, it is important for new graduates to have support as they transition into the role of a registered nurse. They state that this support comes in 4 ways: orientation, safety and support, a themed workshop schedule, and learning. The learning category includes simulation labs, scenarios, and critical thinking. And then also research demonstrates the need to develop knowledge and skills for the perioperative job. The research is unclear about the best way to facilitate the learner in developing that knowledge and skill set foundation. McGuire also states that it is thought that standardization and facility induction programs that use definitive frameworks and provide specialty knowledge resources provides cross-specialty expertise that will cross the contemporary practice milieu. It's common to hear in the nursing world that the reason we do some things is because that's how it's always been done. However, that's not always the greatest way of doing something, or the best way. So some ways that the GI lab has done orientation in the past includes the pathways checkoff sheet. It actually hasn't been updated since January 6th of 2012. So this could be a reason why that procedures and equipment checkoffs are not a part of the requirement for the pathways checkoff orientation. And then, you know, looking back at some of the orientation for prior and previous employees, it's never really had a consistent look for new hires. So that meaning, you know, in May of 2013, orientation was 6 weeks, with the orientee going to their regular scheduled hours of 2 to 4 days per week, depending if they were full or part-time. They had approximately 6 buddy call days for their call orientation, with an additional 6 months call orientation. Each week rotated through a different area of the department, with 1 week training as a nurse and 1 week tech in the procedure room. Then the other weeks would be admitting, another week would be recovery, and then you have 1 week in the cleaning room. Then in October of 2014, orientation changed a little, in that they changed, instead of going to your regular scheduled hours, you went 7 to 3:30, 5 days a week. And then everything else stayed as it was. Then in 2017, the call orientation was condensed to about 3 to 4 months instead of 6 months. However, this was to include a quote-unquote heavy call schedule. So you had to be able to be on call a lot more within that shorter amount of time. So what is the impact socially for this issue at hand? After speaking with managers and directors of GI Lab and the day surgery unit, it's a mutual agreement that now that the orientation is a little more condensed, it's time to update the content of the orientation. So they believe that this could help the new nurses feel more confident in their roles as a perioperative GI lab nurse, as well as in turn, hopefully help with retention rates of new nurses. And then also, some of the other services that could be involved with the training and skills would be the product vendors. They have representatives that come to the GI lab regularly and train the staff on how to use their equipment and products appropriately. So they could also be a part of potentially orientation training of different products that we use and equipment and how it can be used effectively and appropriately. Looking at the strengths and the weaknesses of our particular orientation schedule in the GI lab, or orientation in general in the GI lab, some of the strengths include that it's a condensed orientation schedule for the new hires. This kind of helps eliminate the burnout that could potentially happen for orientation, because you're just kind of so overwhelmed for so long, you just kind of want to get on your own. So that kind of helps with that. It kind of speeds things along a little bit. Another strength would be the pathways checkoff for competencies in all areas of the GI lab nurse duties. So there's competencies in admitting, recovery, where's the fire safety book, just that kind of stuff. Everything you might need to know is in that. This helps with noting areas that have not been covered and need more attention to the orientee. So, if you're in week 5 of orientation and like, oh my gosh, we haven't even covered, 4 things of recovery that we need to. I need to show you where the oxygen valves are and some different things in the cleaning room. We need to go over those a little more. That's a good way of kind of keeping track of what's been talked about, what's been discussed, and what's been checked off. So, and then another strength would be that there are actually different preceptors throughout orientation. So you kind of have a different nurse helping you through everything. This kind of allows the orientee to see a different way of doing certain things and then can kind of decide on their own how they want to successfully complete a task, and they can find their own way. Now, some of the weaknesses of orientation would be that of retention of new nurses. So there can be, in the past, there's been a lot of high turnover rate with nurses coming into the GI lab. With that, in orientation, there is a lot of info to learn and retain within a very short period of time. So this can be a very overwhelming task. So we need to make the best out of it and make sure we cover all things to do with what could be covered in a GI lab for a nurse. Another weakness would be the lack of skills competency checkoffs for new hires within pathways checkoff. So of all the things listed in the competency checkoffs of the pathways sheet for new orientees, there are not any checkoffs for the skills needed for procedures and how to work specific equipment. So those need to be added in and gone over with particular preceptors during orientation. Another weakness of the orientation would be kind of the lack of exposure to special procedures within the GI lab. A lot of the procedures in the GI lab happen outside of the 7 to 3:30 orientation time. This does not always allow an orientee to be a part of the more specialized procedures. Having that skills checkoff would help with that because you would be a part of that skills lab and going over the different specialized equipment and how things would really kind of going over a mock way of doing something, that particular procedure inside the skills lab, so that you're somewhat ready for it when it happens to you outside of orientation. And then lastly, a weakness of orientation would be a nurse feeling of readiness or confidence for position tasks after completion of orientation. So, a lack of knowledge base for procedures does not build a confidence in the orientee that they can be successful. You walk into a room and you're the nurse in that room and you're done with orientation and doctor says, I want to do this specialized procedure. and you've never done it, that doesn't lead to you being confident in your ability to complete the task and be proficient in what you're doing. To kind of effectively evaluate the strengths and weaknesses of this particular problem, it would be a good idea to provide the orientee and the trainers with evaluations of the orientation program. That way you can make it better or change things up a little bit as time goes on, tweak things a little bit. It would also be effective for the orientee to sit down often with either the trainer or manager, or even both, in order to discuss how the orientation has been going. You can do this like weekly, have a weekly 10-15 minute sit down discussion and kind of go over how the orientee feels about things, the trainer feels about things, and the manager feels about things. Looking at the budget for how this would be affected, funding would come from the GI Lab education budget, which is managed by the manager and the director. There is a monthly budget for education needs for our department, so funding would come from that if needed. Don't anticipate any funding to be needed or any extra, because it's already going to be a part of the orientation process, which is already funded. Recommendations to improve the issue. Research shows that within a nurse orientation, it is effective to have a skills lab or competency checkoff for the orientee. I believe that adding a skills competency checkoff to the Pathways orientation packet that is already GI lab specific will help to improve the new nurse orientation to the GI lab. This will actually help to ensure that the new nurses to the GI lab are successfully trained on all of the equipment and their uses, as well as how to set up the equipment for all procedures that are completed through our GI lab. Here is a list of references that were used to help look at the information provided and to kind of assess the community and culture and what can be done to help improve the issue. I appreciate you all for listening and taking the time to look at my presentation. Thank you very much.